effective perineal massage and effective pelvic floor release can help reduce grade 2 and 3 tearing by up to 65%. So how do we do it? Everybody talks about kind of massaging backwards and forwards. What we want to do is stretch these tissues. This is the perineum, and this is where we want to stretch these tissues. So get yourself into a nice, comfortable position if you're doing it yourself. If your partner's helping you, make sure you communicate effectively. Wash your hands if you're going to be using your hands, or if you're going to be using an Epi-NO, make sure you've wiped the Epi-NO down. Start off by gentle lubrication, and I'd suggest a vaginal moisturiser, one that is specific for perineal massage. Use the thumb to apply the lotion around that area. Then you want to make sure you work round like a clock face. So you're going to go 3, 4, 5. You're not going to go directly down, and then you're going to go 7, 8, 9. And each one of these points, you're just going to pop your thumb in just up to about the first bend there, and you're just going to hold that tissue across. All I want you then do is practice your relaxation breaths. Imagine the pelvic floor relaxing, the vagina opening, and you're just in through the nose, really big 360 breathing, and relax down. You can hold that there for up to 10 to 15 seconds, come off slowly and go on to the next point. As you come further down around the perineum, you start to feel that it's a bit uncomfortable. It should never be excruciatingly painful, but it will be uncomfortable, because what we're doing is we are preparing these tissues to allow baby's head to come out for a vaginal delivery. And again, so each point through there. That's if you're doing it manually, or if your partner's doing it with you. Again, communicate to your partner. You can purchase an Epi-NO device. This helps stretch the perineum for you. So you make sure that this is clean and washed. You apply a tiny bit of lubrication over the device there, and then you pop it into the vagina. You make sure the nut there is locked, and then you apply the pumps as needed. You don't put the device fully in, you only put it up to the middle bend, okay? And you're just looking at it, stretching the perineum. You put a few pumps in until you feel that stretch, and then you practice your breathing. Breathe in through the nose, out through the mouth, really relaxing your jaw. I suggest doing this kind of a couple of times a week. Don't do it every day, but a couple of times a week is optimal. When you're up to optimal level and you feel that stretch, you then keep it inflated and you take the device out. Do that, as I said, a couple of times a week. There should be no pain, not excruciating pain, but it will be uncomfortable because we're really trying to stretch this area here to prepare for baby's head to be delivered through those tissues there.